Can you talk to us a little about lasers and what kind of lasers are available?
Yeah. So technology with lasers has advanced. Originally, the original laser treatment was with CO2 and an unfractionated. And when you talk about lasers, the common things that you're going to be hearing is about fractionated and unfractionated lasers. And the fractionated lasers essentially are lasers that burn the entire surface, while the unfractionated lasers burn the entire surface, while the fractionated lasers will burn the surface in almost like in a gridstone pattern. And what happens is, what we found out, or scientists found out, is that by making smaller burns in different areas, the tissue that's adjacent, the collagen will heal and stimulate the collagen adjacent. So what will happen is you have less time down because you're burning a less surface area. And the lasers, you can actually control the depth of how deep you're doing the burn, if you can think about it.
So you can go very deep or minimally invasive.
Yeah. So there's procedures that should be done maybe with sedation, and there's other procedures that can be done, literally in an office in an afternoon without a problem.
Is that what we're speaking about, the laser resurfacing that we're seeing more and more of?
Yes.
That's one of those examples of a laser?
Yeah, exactly. The refractionated laser is something that more and more you can go do it, have it done in an office. Before, when they were doing the CO2 ablative lasers, these were interventions that were done in the operating room because they hurt, whether with sedation. And then the time down for those, the deeper the treatment with the laser, with the unfractionated lasers, what would happen is you would have a longer time down because it's a deeper burn. So literally, we're treating burns afterwards.
This is something I'm really curious about. When it comes to different demographics or ethnicities, are there different treatments that you may recommend?
For sure. When we're talking, especially the darker the skin is, with lasers, you got to be careful.
Why?
Because lasers, depending on which lasers you are, lasers will work on stimulating a pigment. So if the darker your pigment, you have a potential for burning yourself more or having complications. Now with newer technology, there's a capacity to work with certain people with pigmentation, but the reality, and you have to actually prepare your skin before you're undergoing this type of interventions as well. But yes, definitely demographics change, and you actually will have a higher risk of complications with pigmentation or depigmentation, depending on your ethnicity.